Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab. All on your time, live or on demand. This is CSIS Online.
I'm Jacob Kurtzer, Interim Director and Senior Fellow with the Center for Strategic and International Studies Humanitarian Agenda. We recently finished a conversation with Molly Gray, Lieutenant Governor-elect for the State of Vermont. This conversation was the last of the year for the Humanitarian Agenda, and I think it was appropriate. We've done much reflecting this year on the substantial impact of the COVID-19 pandemic on crisis-affected, conflict-affected countries abroad, all while keeping one eye focused on our cities and states here at home. Early on in the pandemic, many of us who worked or visited humanitarian crises watched in disbelief as scenes we were familiar with from our travels manifested here, with field hospitals in New York, Doctors Without Borders working in Italy and elsewhere in Europe, and now UNICEF doing feeding in the UK. In some ways, the pandemic has reminded us that the divide between international and domestic work is always artificial. For those of us who've advocated for increased attention towards humanitarian and development issues, a core part of our argument has always been the myriad benefits for our domestic interests. But even more so, the experience has reminded us of the othering we sometimes engage in, that when we talk about food security or access to health and education abroad, we still have many complex challenges to tackle in the United States, one of the wealthiest countries in the world. And inside the Beltway, it's very easy for us to focus on our niche issues and not place a lot of attention on connecting the broader global issues we work on with domestic issues that matter to everyday Americans. And I think this is becoming increasingly important with humanitarian work. And so I'm very grateful that Molly was able to join us today and to unpack these issues. The full disclosure, Molly and I used to work together at the International Committee of the Red Cross. And in fact, I followed her capable footsteps to the Washington office. I'm also incredibly jealous and have a serious affection for the state of Vermont. I have a deep affection for Vermont, especially the Northeast Kingdom, based on two visits, one for the chaotically delightful Coventry Festival, and also it was the location of my honeymoon in Burlington and a visit to Nectar's. I'm confident that you'll enjoy the conversation with Molly and that she'll serve the state of Vermont well. Due to technical issues, we'll join the conversation in progress. I was particularly struck by what they call work on behalf of missing. Efforts that the ICRC delegations, the organization does, usually with their national Red Cross or Red Crescent Society partners, to help people reconnect with individuals who have gone missing. And I know that some of your field visits included locations where that was a focus of the work. And so thinking about a stay-at-home order and the sense of disconnectedness people have with their loved ones, the inability to maintain those contacts. How do you see the role of the state in this case, helping to ensure people maintain a sense of connectedness and community when our public health requirements dictate that we maintain this type of physical distancing?
Yeah, I think it's as much about the missing, which is such an kind of interesting concept. It's the work of the ICRC, as you said, in places where individuals have in large part died and families do not know where loved ones are. And it's so important to have closure, right? Identifying where the missing may be. This was the case in the Western Balkans and Iraq. But on the other hand, it's also restoring family links, which is not only something that the ICRC does, right? That this organization working in conflict worldwide, but also the American Red Cross, the Vermont chapter of the Red Cross, working to make sure refugees or former refugees in our state are able to connect with family in Somalia or in the Congo. But if we think about that, the restoring family links aspect during this pandemic, it works if we have landlines, which a lot of Vermonters, I'd say a lot of Americans don't have anymore, right? We're on cell phones, but that only works if you have cell service or internet access. And in our state, and I think like many parts of rural America, broadband is not a given. It's still for a lot of folks in a lot of places kind of a nice to have. 1/4 of Vermont geographically, our beautiful Green Mountains come with a lot of challenges. Is disconnected. 1 in 3 children in in the town where I grew up couldn't get online, still can't get online. So if we think about maintaining family connection, maintaining connectivity for our sense of community, our sense of wellness, mental health, access to basic human needs and resources during a pandemic, telemedicine, online learning, remote work, it links to economic security. I think access to the internet is now this highway to accessing basic human needs.
At CSIS last year, we hosted a task force on humanitarian access, and this actually was something that came up quite a bit, that the conversations about access and access denial in situations of armed conflict frequently are either rooted in intentional access denial by a party to the conflict, or often the logistical challenges. But the second order part of that conversation was access to what? And information has become, it's almost as essential a commodity. If you get past basic human needs, people in conflict settings or natural disasters, they want to know what's going on. They want to be able to connect to people. And again, it's striking to me to think of Vermont, which, maybe I idolize because I, live in the Washington suburbs, but as having that kind of challenge, just purely as a function of physical geography, setting aside the challenges of, broadband access. I want to ask you, when you reflect back on your time working with the ICRC, are there specific moments, visits, contexts that resonate and inform the way you think about health or education in the state of Vermont? Any particular trip or moment in time that you can share that you think about when you look at the challenges that you have ahead of you?
Yeah, I don't think there's one example around education, for example, although if we talk about broadband and just connectivity, I think it's incredibly important. I think that was a different issue when I was working for the Red Cross, but just because it was a different time, right? Restoring family links, it wasn't thought of as happening over cell phone calls or Zoom calls, right, that we're experiencing now. But if I can think about detention, right, a lot of the ICRC's work is grounded in places of detention around the world, and making sure that states are abiding by their obligations under the Geneva Conventions to provide humane treatment and humane conditions. Here in Vermont, we, at the start of the pandemic, did this holistic review of all prisoners, detainees in our prison systems in state, and we're actually able to reduce the prison population because of individuals who were there that didn't need to be there. In some cases, individuals who were going back into the prison system because of technical violations of parole because they couldn't find a job, right, which is economic security. Were unable to find housing and then end up going back in prison. So there's a lot of links there, but I think the kind of bigger question that was raised was Vermont has an out-of-state prison population. There's over 200 Vermonters who are in a private prison in Mississippi. And if we think back to the Red Cross principles around restoring family links and making sure that families can stay connected, especially in a state that doesn't have internet access, there's an opportunity now. And I think the state's going through this reflection that, for me, feels really grounded in the work of the Red Cross, that these principles that are grounded in IHL also apply in domestic settings to bring our out-of-state Vermonters home and to ensure that they have access to family and community here in the state. And this is the case, and I'll just share briefly that part of the work, as you know, is to make sure U.S. policymakers, when I was working for the Red Cross, was to make sure U.S. policymakers understood how these things play out in practice, like what I was just talking about in our own prisons here. And so, visiting prisons in Haiti that were trying to navigate, restoring family links, or prisons in the Congo run by the Congolese government, the government of the DRC. And I think it's just really important to recognize that there's a lot of principles that we can draw from the international landscape to what we're doing right here at home.
Thanks. I guess I was not aware. I don't know why I would have been aware that there are Vermonters incarcerated in Mississippi. I think we collectively have a lot of work to do to think about our criminal justice system in general. But when I reflected to people about the work the ICRC did in detention, I mean, the questions, there's a sometimes well-intentioned, sometimes more caustically raised question about like why, right? People who are incarcerated have ostensibly created some violation, maybe not in a situation where I'm conflict, but and the answer I think is one of vulnerability, right? You know, when you are detained, regardless of the circumstances of your detention, you are uniquely vulnerable to abuse, and the question of vulnerability underpins a lot of humanitarian action and assessments of needs in the aftermath of a crisis. And, you know, so thinking about the totality of a state population or a city population, how do you think about vulnerability domestically? You know, who do you think about? How does it inform your thinking about service provision or outreach to different communities? What lessons can you draw from the way the international community, you know, the international NGOs have done it towards your, you know, your home state?
I think the first thing to recognize is that we're still in a pandemic, right? We are in a global crisis, something that we haven't experienced, I mean, in our lifetime, right? The last pandemic was 100 years ago. But if we think about our response, and we pride ourselves in Vermont, and I hope, I'm just going to talk about Vermont because I love our state so much and I'm so proud of what we've done, but we have our own, in many ways, Dr. Fauci. It's Dr. Levine, Commissioner Levine, who's really led the health response. And we've gotten some attention nationally because the first thing that happened in Vermont's response effort was to identify the need. There was a really, really big push, for example, to identify housing insecure Vermonters and to make sure we were retrofitting motels and hotels into temporary, and then now we're moving into longer term housing facilities. We were really quick to think about where we could pop up access to wireless routers so that some kids could drive into town and park outside the library to access the internet, to access online learning. I mean, by no means a long-term solution, but I think some pretty thoughtful efforts to identify need and address it. But there was also a lot of gaps. And I talked earlier about neutral, independent humanitarian action, right? NIHA, which is what we, working with the ICRC, are so ingrained to understand and do and think about. But if we look back at 2020 and events that happened after the pandemic started, the killing of George Floyd, for example, we had this major conversation that started nationally, and a lot of justifiable social unrest, and a lot of conversations, I think, here in Vermont about is there a systemic racism in access to education, and access to housing, and access to healthcare. We have a large former refugee population that didn't receive information on the pandemic because it wasn't translated, and not only not translated, but not disseminated appropriately to really vulnerable communities. So I think as we think about those principles, we also have to recognize where our institutions have systemic bias in them that may not allow for proper assessment of need and recognition of the long-term need that needs to be addressed more fully.
Thanks. You mentioned these communities. So, you know, our intention today is to think, you know, kind of what we learned from working over there and applying it over here. But I did want to ask you, actually thinking about it, flipping the lens a little bit. Our colleagues in the Africa program at CSIS launched a series recently on the connections between the African continent and American cities, and found links in places like Boise, Idaho, and Birmingham, Alabama, economic links, cultural and otherwise. And so, you know, for advocates or for policy thinking it's a different way to think about international relations. We tend to think about it as the U.S. and a partner, or the U.S.'s interests in X. But what are the key connections in Vermont to foreign contexts, and particularly any that might be facing a humanitarian crisis? And how do you engage with those communities? Thinking about the national picture.
I think it was Tip O'Neill who said all politics is local. And in many ways, this is a moment where we need to truly recognize that all international affairs are also local. And the same goes for human rights and our application of principles surrounding IHL. And I think we need to go no farther than just looking in our communities and identifying need. But if we look at those specific linkages, one, Vermont is a state that has been a focus of refugee resettlement for decades. Our senior senator, Senator Patrick Leahy, has been on the Foreign Operations Subcommittee of the Appropriations Subcommittee and has really been fighting for U.S. foreign assistance, and also making sure that places like Vermont can be sanctuary states, in large part, places where we're welcoming people from around the world who are fleeing persecution or crisis. So in Vermont, in Burlington in particular, we have a large Bhutanese, Nepali population, Somali population, Congolese population and community. And I was just talking to the American Red Cross last week, and part of the work that they've done through the Restoring Family Links piece of the Red Cross mandate is just to keep relations between the Somali refugees in Vermont and families still in Somalia. But these are places that are around the world where we're not hearing a lot about what's happening globally right now. And I think if we reflect on 2020, our focus in many ways has been so laser on the local issues of our communities, the domestic politics, which hopefully we're moving on from that and now reopening an engagement globally to understand what's happening. And are there places in the world that we've kind of lost touch with, where we need to make sure that we're supporting communities who have family members who are in need?
So in one of our conversations running up to this, I learned something new, that the Lieutenant Governor and Governor of Vermont run separately in the upcoming governance session will be of opposing parties. And so I'm trying to think of, I'm curious if you can think of, in the context that you looked at, where international organizations were working with, in this case, like violent conflicts, but parties that were fundamentally opposed to try to reach some sort of common humanitarian outcome. How does that inform how you'll reach across the divide? And do you see any benefits, for the citizens of the state in having, this kind of divide within the state capital?
Yeah, Vermont's such an interesting place. We have Bernie Sanders, who's really been the leader around a statewide, national, even global sort of progressive movement. We have a Republican governor who was just resoundingly reelected, won statewide in a very, very big way, in large part, I think, because of his incredible and Vermont's incredible collective response to the pandemic. And now I'm coming in rather as a lieutenant governor, very excited, ran as a Democrat, and feel very grounded in the principles of the Democratic Party. But what we see in the state, and have always seen, is that we have this constant shift back and forth between having a governor and a lieutenant governor from different parties, separately elected. It's not like, the president and the vice president. And so in many ways, I think there is this balance that is sort of manifest within our local political system, but we also see Vermonters really focusing on the person, the issues, rather than the party. And I'm not sure I would run for office in a different place, not only because I just absolutely love Vermont and see our state as being a place where we can be an incubator for a lot of good nationally, but also because I think that we can come together on specific issues. And I've always believed, and I think our governor believes as well, we've seen this over the last year, that be it on emergency food assistance or deploying a vaccine or helping to get broadband, in the smallest way to communities, that if there's political differences are put to the side and it's really about focusing on an issue and trying to bring everyone together to get it done, which if I go back to the ICRC, that's something that's so deeply ingrained, right? It's trust, it's communication, it's sharing the facts and sharing them accurately, which I think Vermonters in particular, but Americans more generally, are thirsty for that kind of leadership.
Thank you for that very effective segue. I want to talk about trust and communication. And you mentioned Commissioner Levine as Dr. Fauci type model in Vermont. So slightly more sensitive, I suppose. But one of the challenges facing humanitarian organizations and everyone really is misinformation. When people have bad information and disinformation, the intentional distortion of facts or narratives for various different reasons, and there's the classic example, I think, for humanitarian organizations is in the Ebola response in DR Congo, when the early arriving humanitarian organizations were widely distrusted because of misinformation, and as a consequence, it set back their response. And so, I think we all recognize the importance of establishing trust, but American politics is clearly not immune to these challenges. And so what role do you see, from within government, where you're sort of immediately distrusted by some segment of the population? Like, how do you in government combat the flood of misinformation? And how do we get back to a common understanding of challenges, even if we disagree on the solutions, at least having at least working off the same problem set?
Yeah, I think what you said around working off the same problem set, right? Like, we just need to get to the point where we agree that the facts are the same and that the problems are the same. I mean, I think we're living in the most divisive time in our history politically, without question. But then even basic information, right? Are the vaccines safe? Are they not? Do masks work? Do they not work? Just the amount of times Vermonters, Americans have had to grapple with just questions around science and fact, that in many ways, I think we need to leave the professionals and empower the professionals who are dealing with the science every day to share that information and to be amplifiers. Now, I strongly believe it's time for a lot of us just to get off Facebook. And if Facebook's listening today, I'm sorry, it's probably not what you want to hear, but it's the truth. I think we are now seeing proliferations in disinformation, and the war of 2020 and beyond is fought now in the digital space. And I think as leaders moving forward, we're going to have to think very, very carefully about what tools we use, what steps we take to make sure that businesses, right, Twitter, Facebook, Instagram, TikTok, I don't use TikTok, but if they're going to exist in our countries and our borders and with our state borders, what is our responsibility to make sure that information is reaching our communities that's accurate, that's truthful, and that is leading to understanding of the facts. And I think that's, we're in a brave new world, and especially when we are isolated at home, and will continue to be, at least for the coming months, how will we make sure that we're sharing information correctly? So it's a brave new world. And I don't think, if we can talk about IHL for a second, I'm not sure IHL has evolved. The laws of war have evolved, even human rights laws evolved to fully navigate this space where we see businesses taking on more and more roles and responsibilities that I'm not sure we always feel comfortable with.
There's like a a whole gaggle of people we know in Geneva whose ears just perked up and will say, no, 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 the problem is not the law is applicable, you just have to, right? Like this is, I agree with you. I think that law lags, right? I mean, the evolution of law and the complexity of designing laws, it's always going to be behind. And the technological changes, the rapid nature of the universe that we're living in now, I have been making fun of my coworkers because they require Google Maps to go from point A to point B. That's I grew up at a time where you actually still, I'm not old either. Well, I'm probably old to some people, but I wanted that last question. We've gotten it from the audience as well. Evan Antel asks from Vermont, your insights and how we deal with a stratified political atmosphere and the fallout. And I think you've touched on that, but on the Facebook point, I think it's a really interesting question. Now, I solved it by removing it from my phone, right? And limiting my frustration elements to like when I sort of dictate going on there. Facebook is a really interesting question for me because having also lived and traveled around the world, I'm able to stay connected with this massive group of people. And yet every time I go on it, I feel like I'm contributing to a disinformation platform. And how do I balance personally that divide between the service that provides me some really important human value, but is also spreading, and is contributing to this this political fallout that Evan has described? And what do you think the role of government is there in dealing with a platform like that?
I think government does have a role. I teach international human rights law at night at Vermont Law School. I'm not doing so currently, but we did a whole session on sort of what is Facebook? Is Facebook sort of maintaining the lines of communication in the way an electrician or a plumber would? Are they sort of maintaining an infrastructure, or are they more like the New York Times or the Washington Post? Are they journalists thinking about information that's being shared with the public? And every time we post something, we're writing a commentary, writing an op-ed, if you think about it in that way. And I don't think we have come to terms as governments yet with what is this thing. And if we decide that it's more like the prior, that it just needs to be maintained, then what is the role of government to sort of make sure that people are not feeling threatened and that it's a space that's conducive to proper dissemination of information? If it's more like the latter, then is there a responsibility of these businesses to engage in the proper dissemination of information? I'm not sure how that happens, but I think it's a conversation that we need to have, because we're seeing not only the impact on our democracy and the political process and the dissemination of inaccurate information, but just how we engage with each other, right? In our communities, within our own families. And so it's a conversation that has to happen at the local level, at the statewide level, and certainly at the national level and internationally. I mean, we've created something that's going to impact the way we engage for the rest of our lives.
Yeah, I mean, the news of this week, there's these multiple states attorney general bringing suits against both Facebook and Google. I think will be really interesting to follow. There's core legal principles, but as it relates to the spread of misinformation, the effect that the fact that so many different states have banded together to say, like, we identify that there's a serious problem here, I think in and of itself sent a pretty important message to the private sector, about their business model. I had a question for you I wanted to ask about private public partnerships, but we have another Vermont specific question. And so I'm going to turn, we have this from Lachlan, who, governance is about balancing competing interests, right? I'm paraphrasing the question here. So that considering the importance of agriculture to the Vermont economy and heritage, and similarly, for many of the communities around the world, the question is of balancing the need for climate change mitigation at the state level with preserving both the economic vitality and cultural importance of the agricultural community to the state of Vermont. So how do you see balancing those competing interests going forward?
You know, it's a really interesting question, because I'm not sure they're entirely competing. I think what we've learned over the last year is that food security, right? And if we reflect on working in crisis, right? Food security is linked to economic security. Economic security and food security are both linked to climate security. And I often said, traveling around the state over the last year and just talking to Vermonters, we saw maple sugar makers boiling sap in January, which is unprecedented. Normally you start boiling in February or March. More tick-borne illness than ever before, in a state that, you know, prides itself on, you know, allowing people to walk through the fields and the mountains and doing so safely. More and more people having to make snow to stay open. You know, it's snowing today, but we've trusted the science in responding to this pandemic. I think we're in a moment where we have to trust the science in thinking about the economic security and Vermont being a place that's climate secure. And then if we think about that and take it one step further, it also means that if we're going to create more stability at the local level, we have to invest in local food secure systems. We're a state that not only now has the best beer in the world, the best cheese in the world, people are growing and making kimchi. I don't know, it's a thing. But I really see that, you know, as we move out of this pandemic, right, in the same way the Red Cross is probably thinking about moving out of an emergency assistance phase. You know, we were distributing 500,000 meals ready to eat to Vermonters in May and June in a pandemic. I mean, that's pretty significant. I think we have to think about, what are we going to do if we move into development or move into recovery to strengthen those food systems that are so linked to economic security and climate security?
We have a lot of questions that I want to cover, but I've also recognized we're starting to come close to time. So I want to pick up on something that we talked about before we kicked off here. We talked about the quote unquote snowpocalypse of 2010 in Washington, D.C. Washington does not handle snow well. We got dumped on, and you mentioned at the time that you trudged to work because it was also the time of the earthquake that hit Haiti. And during our conversation, you mentioned the Vermont Red Cross, the American Red Cross chapters in Vermont. And so, you know, I want to like draw out this idea in the humanitarian sector. There's this whole trend towards localization of, you know, humanitarian response should be led by the people most close, culturally, geographically, you know, the people in the region should be led. And the model now is one of internationals coming in and leading the response and taking up much of the funding. And so having worked with the ICRC, having, assessed and analyzed the work of the Haitian Red Cross in partnership with the American Red Cross, can you talk a little bit about the role that American Red Cross plays in Vermont and the importance of learning both ways, learning lessons from what we can share from the United States elsewhere and what we can learn from national society partners in other countries in responding to crises in the United States?
Like 4 questions in one, but I'll give it my best.
It's my Tony upbringing.
I love it. What I've learned from talking to the American Red Cross, this is a proud moment for Vermont, is that we actually have, I think, more people who donate blood per capita than any other state. I could have that wrong, but we just spoke last week, so I think I have it right. And our hospitals absolutely depend on blood and receive blood from Vermonters. So it's this really hyper localized from community to hospital initiative, and it's working, right? And I think that's really important. It's a good example. But I said earlier, quoting Tip O'Neill, that I think he said all politics is local. And I was so transformed by working for the International Committee of the Red Cross, and have spent much of my career understanding international human rights, working overseas, trying to be the lawyer that's 100% trained on how to get governments to change their behavior and comply, and also businesses. And I think as we look around our country right now, and as we look around Vermont in particular, I'm constantly reminded of Eleanor Roosevelt's quote, right? The drafter of the UDHR. And she rhetorically sort of asked and answered, where does human rights begin? It begins close to home. And I think if we're going to reflect on the humanitarian principles, we have to also acknowledge that the humanitarian systems in some ways can be a paternalistic system, right? Where you have people coming from the outside, coming from the United States, coming in and not understanding the local need. And so here in Vermont, if we think about that at the local level, I think it's time to sort of get out of our state houses, get out into our communities, truly understand the needs that have been fully exposed by this pandemic, and then trying to rebuild a system that is equitable, that is hopefully with a lot of intention and a lot of hard work, free of systemic racism and bias, that is really set up to also understand what's happening globally. And we are coming out of something that has impacted all of us, right? It impacted not only every American, but every person in the world has been impacted in some way by this pandemic. And so hopefully there's a way for us to recover stronger on the local, on the national, and also on the global level that leaves us more united at the end.
Sure. Yeah, was muted. So we've come to the end of our time. I'm very grateful for your joining us today. You know, I think this is really an important opportunity, and the experience that you bring and the time that we're in the United States facing this kind of crisis. You know, I wish you the best of luck in taking on your position at the State House. For our viewing audience, this will be the last of our online events for the year. So thank you very much for joining us. For our Vermonters, all our events are broadcast live online. So please join us again in the future. And thank you again, Lieutenant Governor-elect Greer, for joining us, and wishing you a great snowy day and happy holidays.
Thank you so much. It was such a pleasure.